Hello, and welcome to the Geriatric Core Principles presentation. This is a collaborative educational endeavor that's supported through the Health Resources and Services Administration. Review of this material and the remaining of the material available on the SkyPrep app will provide the basic information you need to participate in the interprofessional simulations. I'm Dr. Jennifer Drozd. I work at Summa Health, and I'm an assistant professor at Neomed. As you move through the slides, notice that some have question marks like this up here in the right-hand corner. These are challenge questions. We encourage you to take a moment and think through the answers. If answers don't appear, click to advance the slide. For our first portion, here are our learning objectives. What is the central focus of a comprehensive geriatric exam? A person's functional ability. A geriatric exam looks at the physical, psychological, and socioeconomic factors that impact a person's health. All three domains need to be assessed. The most important focus with all of these is a person's functional ability. We'll use Mrs. Smith as an example. She's a 78-year-old married female. She has a history of COPD, cardiovascular disease, hypertension, urinary incontinence, and osteoarthritis. She worked as a machinist at a local factory until she retired about 20 years ago. She did smoke for 30 years. If we look at these two photos, which one most accurately depicts Mrs. Smith? If you said either photo could depict Mrs. Smith, you're right. It's hard to tell based on the information that was provided what her functional ability and her overall appearance might look like. When completing a functional assessment, we're looking at the ability of an individual to manage their daily care needs, their ability to complete ADLs or activities of daily living, which is their ability to do basic self-care activities such as dressing and bathing, or IADLs, the instrumental activities of daily living, such as meal preparation, shopping, and financial management. The other area is mobility, how well the person can get around in their home or move up and down stairs, and are they able to walk or travel outside of the home safely. The goal is to have them maintain their function, or if a person becomes ill, get back to the optimal functioning level. We support the patient through symptom management and support systems within the family and the community. As people age, they have changes in all systems of the body. However, these changes alone are not necessarily enough to cause illness or disability. Everyone ages, and how people age varies from person to person. The one thing that aging process does cause is an increased susceptibility of the older adult to illness and a decreased ability to recover. What are some expected physical changes that occur with aging? When working with the older adult population, it is important to work with an interprofessional team. This team includes multiple professions that can help identify problems and help with the plan of care for an older adult. The most important part of the interprofessional team is the patient and their family. As older adults often have multiple medical problems, along with socioeconomic and psychosocial influences to their health, a group of providers can identify problems, help to coordinate services, and develop a comprehensive and integrative plan of care. The goal of this plan is quality of care for the older adults and improved safety and cost effectiveness. Mrs. Thompson is a good example of how an older adult can alter their health trajectory by incorporating principles of a healthy lifestyle. She's currently 83 years old, but when she fell 6 years ago because her blood sugars were uncontrolled, she fractured a hip and required surgery. While she lives with her daughter, who helps with some driving and shopping, since surgery, she's completed therapy and has begun to take care of herself. She's lost 35 pounds and can now walk 2 miles a day and is active in the community. So let's discuss some myths associated with aging. So myth, health promotion is wasted on older people. As seen with Mrs. Thompson, even at 83 years old, by changing to healthy lifestyle behaviors, she's improved her quality of life. She's active, walks multiple miles a day, and is managing her diabetes and weight. It's never too late to begin healthy lifestyle habits. Preventative health measures should be encouraged with the older adult, including immunizations, physical and mental activity, and advanced care planning. Myth. Most older adults are set in their ways and cannot learn new things or take up new activities. Older adults can get involved in activities. They can learn new things and should be encouraged to stay mentally active. Finding things that they enjoy can bring satisfaction and happiness to their life. Many colleges and universities offer free courses to the older adult. There are also senior centers where many older adults can meet and get involved in activities. Myth. Older adults do not pull their own weight and are a drain on societal resources. Many older adults are involved in various activities in the community. They volunteer, help with grandchildren, and may still be active within the workforce. Another myth is that older adults are isolated and lonely. While many older adults experience the loss of loved ones and friends, they often remain involved in the community with clubs as well as traveling and staying connected. As you can see, age and poor health doesn't necessarily go together. People can age and have very few problems caring for themselves in their own home. Quality of life is a personal determination of the individual. Function, ability to care for themselves, and their own beliefs determine quality of life. Even those with chronic illness may say they feel they have a high quality of life. Ageism is a stereotyping of an individual or group based purely on their age. It is a form of discrimination and prejudice. It can affect how older adults are treated in general and can affect how healthcare is given. As healthcare professionals, we need to be aware of our own biases and work to treat everyone equitably and fairly. It's important to realize that the care of older adults does present its own challenges, but it is also very professionally rewarding. Here are some additional references and resources that were used for the first section. Our next topic is on advanced care planning. For this section, here are some objectives. Let's return to Mrs. Smith. She's a 76-year-old female and you're meeting her for the first time as a new patient or client. She has a history of COPD, coronary artery disease, incontinence, and osteoarthritis. She's independent and manages her day-to-day activities without difficulty. When you're meeting her for the first time, what should your initial assessment include? If you said all of the above, you're correct. True or false? Since you do not expect Mrs. Smith to have a serious or life-threatening illness in the next 6 months, it is not appropriate to begin advanced care planning during your initial visit. This is false. Studies show that older adults want to talk to their healthcare providers about advanced care planning and goals of care, and it should be incorporated into routine healthcare and assessments for all members of the healthcare team. So what is advanced care planning? It's an ongoing discussion between healthcare providers, patients or clients, and their family or proxy decision makers to plan for future medical care in the event that the person is no longer able to make decisions. It's focused on their goals and values and should include the proxy decision maker in the event that the person is unable to make his or her own decisions. So advanced care planning is an important part of the interprofessional team function, and each team member has a responsibility to identify the goals and values that determine care for their individual patients and clients. So can you name some types of advanced directives? So the living will, do not resuscitate orders, powers of attorney, or medical orders such as most imposed are all types of formalized documentation for advanced care planning. True or false? Mrs. Smith tells you that her friends are worried that she's completed a living will because they feel that if she goes to the hospital, she won't be treated. Well, this is false. Advanced care planning and completing advanced directives provides guidance for the medical care team if the individual is no longer able to make their own decisions. Until that point, a person is fully capable of making their own medical decisions. So what determines medical capacity? A person who has decision-making capacity has the right to make their own decisions, for better or for worse. Medical illnesses can cause a temporary loss of capacity, and in comparison, competence is a legal determination that's determined by the court. So what characterizes decision-making capacity? They must be able to demonstrate an understanding of the decision, discuss potential outcomes, clearly express a decision, and provide a rationale. A healthcare power of attorney is a legal document that names a proxy decision maker to make decisions if the person lacks capacity. The challenge is that the patient must discuss their goals, values, and wishes with this person while they're able to in order to guide their future care. So how can you, in your role as a team member, discuss advanced care planning with your patients or clients? While this may vary based on your specialty and your relationship with your patient or client, it's important for all team members to discuss their advanced care planning or your goals for their medical care with their patients and clients. For example, if a speech therapist is working with a gentleman who's had a stroke and is struggling with their swallowing ability, and he repeatedly states that his biggest goal and wish is to be able to eat his wife's famous meatloaf at least one more time, you know his goal, and this helps you to guide not only his current care plan, but also the care plan if it needs to change. As you can see here, each discipline has a statement regarding the role that their members play in advanced care planning. To learn more or for additional patient resources, please visit these websites. Our final section for this PowerPoint is on family caregiving. Here are some objectives. As you've seen through the other portions of this presentation, caregivers and family caregivers are extremely important for the care of older adults. Can you name some characteristics of people who are unpaid caregivers to older adults in the home? As you can see, the characteristics of caregivers are very wide and far. They encompass every sector of society, male and female, rich and poor, and all types of socioeconomic and ethnic groups. Unpaid caregivers are the backbone of long-term care in the United States. They provide up to 80% of long-term care service. The average age of a caregiver is 49. They provide an average of 4 years of care, and over a quarter of people provide more than 40 hours of care per week. This is a full-time job. What is the estimated value of caregiving in the U.S.? If you said 522 trillion, you're right. What activities make a caregiver? Caregivers do some of this, or all, and more. It's important to remember that some people will refer to themselves as a caregiver only if they're living with a loved one and providing hands-on daily care. But a caregiver may also be taking a person to medical appointments or picking up prescriptions. Because of all the things that caregivers do, they are a vital member of the care team, and for some, provide that continuity in a complex medical system. Let's meet Mrs. Jackson. Mrs. Jackson cares for her husband, who was diagnosed with Alzheimer's disease 6 years ago. She feels overwhelmed by the stress of caregiving. Mr. Jackson wanders at night, and so she's unable to sleep. He requires supervision with most of his activities, and he gets anxious and acts inappropriately when he's in public. After 67 years of marriage, he sometimes doesn't recognize her, and what hurts her the most is that they were always very close, and she misses the intimacy that they once shared. She feels that she's already lost him. As you can see by Mrs. Jackson, caregivers may have different needs. That's affected by the complexity of the medical situation and the degree of care that's needed, family or spiritual background, a personal vulnerability from the caregiver, and what that interpersonal relationship was between the care recipient and the caregiver over the years. True or false? Adult children caring for a parent face greater challenges than spousal caregivers. This is false. Spousal caregivers actually experience much greater challenges, in part because they live with the care recipient. They feel they have little choice in the matter. They're less aware of the toll that it takes on them, and they often become invisible to providers. True or false? Depression and anxiety are more common in caregivers, but it has little effect on their physical function and health. This also is false, as caregivers often experience poor general health. They exhibit decreased immune responses, slow wound healing, and often experience depression and anxiety. They are at increased risk of hospitalization and death compared to their non-caregiver counterparts. So when the caregiver becomes the patient, it's important to assess the level of caregiver stress and the impact on health. Mobilize family and community resources. Reassure the caregiver that their needs must be met in order for them to continue to provide care. Make a realistic care plan. So think about it. Have you been a caregiver? Or has someone that you love been a caregiver or needed care? How did you respond? What challenges did you see? And what rewards did you witness? The rewards of caregiving are immeasurable for many folks. It provides a sense of accomplishment. They're able to develop new skills. They may witness this as a spiritual gift, and they're able to bond with their family relationships. If you'd like more information on caregiving in the family, here are some resources and references.